Welcome back. Putting a loved one in a nursing home is an emotional decision that many of us will be forced to make.
Yeah, so please help us welcome back attorney and advocate for Florida senior citizen Steve Watrel. Steve, thank you for your time and thank you for joining us.
Thank you for having me back again.
So you've got some factors really that you say we might want to consider when the time comes to make a decision about putting our loved ones in a nursing home.
Correct. I think the most important thing is to be proactive. What I want to stress to the audience is that you want to start the process early. And there's a good reason for that. The good facilities in town generally run full. Now, beds do come available periodically through the month. So if you start early, you can get on all the waiting lists for the good nursing homes, and when a bed's available, you can put your family member in. However, if you procrastinate and wait until the date of discharge from a hospital, likely the choice will be made for you, and it won't be one you generally are happy with.
Sure.
So when is the right time when you're assessing your needs with your loved one? When is the right time to start looking for a nursing home?
Well, there's two general scenarios that I see in my practice. The first is when your loved one's health condition has deteriorated to the part of a crisis for them or your family. And an example would be someone with severe Alzheimer's. They are doing dangerous things like leaving the gas stove on at night. They wander from the home and get lost. And then the second scenario we commonly see is when somebody has an acute medical condition, a heart issue, or they undergo surgery. They're going to need some form of rehab, and it's always best to start early. And if it's an elective surgery, you want to start planning that rehab visit, at the time you schedule the surgery. There's no need to wait 2 more months until the date of discharge. Start early and get on the waiting lists.
Now, Steve, you also say that it's important to really consider what is the condition that your loved one is dealing with and matching that up with a facility that handles that appropriately. How can we look more into that and see what facilities are rated, perhaps?
Yeah, there's two really wonderful websites out there that you can look at. The first is the Florida Agency for Healthcare Administration, Florida Health Finder, and the other one is the federal government's Medicare.gov website. And when you look on those sites, they'll tell you the services they have available. For example, with an Alzheimer's patient, you want to place them in a facility that has a dedicated locked unit. Not every facility has that, and if you put them in the wrong facility, we've seen cases where they wander off and get injured. And those two websites have a lot of information about the staffing levels, the type of services they provide, language barriers. I mean, if your loved one speaks Spanish but nobody at the facility speaks Spanish, right, it's a disaster, and we've seen that before. And one great thing I want to mention about the ACA website is they have the surveys of the facility. By law, each nursing home is surveyed every 15 months. That's the most critical information you need to look at, because if the facility you're considering has been cited for not feeding residents, not turning and repositioning, you want to avoid that facility.
Right.
This could really be a precarious situation depending on how your loved one is. And I understand you have some good information or something special for our viewers today.
Correct. What we've put together on the website is sort of a kit which will help make the process easier. There's an infographic which sort of summarizes the search process, and then a nursing home checklist, which when you actually go to tour the facility, which we recommend everybody tours the facility at least twice, that'll help you at what factors are important to look at. Because if you've never done this before, you really have no idea what you should be looking for.
You got it. And there are some great tips that you share too, but you also say it's really important to talk to others about what their experiences have been with nursing homes when you're kind of shopping a home for your loved one.
Absolutely. I think that's one of the most important things is you want to go talk to your family, your friends, neighbors, co-workers, and church members, because everybody's had a good and bad experience at a local nursing home. And based on the input you get from those folks, it'll help kind of weed out the ones that you don't want to go to. And then when you go to the two websites I mentioned, I think that'll really help you make a good decision. I mean, we see people, they'll look, when they purchase a car, they'll spend hours researching prices and reviews, but they'll make a nursing home decision, which is a life and death decision, in a minute or two, which is sad.
And you can expect that they would have references?
Absolutely. On the websites, there's different, things you can look at, and then also your friends will give you, I think, good references as well. And when you combine that with the touring part of it, you'll make a good decision.
Now, Steve, after the first of the year, is it true that you're going to be coming back and we're going to kind of continue this series and you're going to be talking to us about testing your nursing home knowledge?
Correct. What I wanted to go through was some of the things we're talking about, the actual information, how to look at it, how to analyze it, because again, there is some lingo in there, there's a little bit of a learning curve, but this is an important decision and you need to learn it, just like if you're making another key decision in your life.
You got it. Well, Steve Watrel, thanks so much for the great information and for stopping by today. We appreciate your time.
Thank you.
Thank you.
And we'd like to thank Steve Watrel, of course, for sponsoring this segment. For more information or to set up a free consultation, call 904-723-0030 or visit stevewatrel.com. It's there on your screen. You can also download the nursing home guide that he mentioned for free.